heterogeneous reasoning of ozone use and antioxidant therapy in complex treatment, posttraumatic arthritis, and early prophylaxation of creation of osteoarthrosis. Dear colleagues, Presidium, one of the important issues in orthopedics is informal treatment. The intercaviar has peculiarities in developing itself in terms of structures, in terms of creating buffer areas that lead to post-traumatic inflammatory processes, affecting process leading to destruction, destroying processes. Paper show the importance of treating this with, the number of treatments are very large, but as of now there are no adequate approach in treating these conditions. The purpose of work is to create the genius connection of systemic metabolic disorders and functions of tendon, synovial membrane, based on the information to create treatment method. The research included two units, experimental and clinical one. We studied 224 rats that have standard vivarium conditions. We shows traumatic damage model on white rats. The slide shows stages, aseptic conditions under combined anesthesia. But the four was injected into the funeral. And after that,
then the needle was taken out, sutures were put through all the layers. On the 3rd, 7th and 28th day, there were examinations. The animals were divided into 8 groups and 3 blocks. The first block evaluated the developing pathological disorders after traumatic damage of the joints. Second block evaluated the influence of minisolid therapy and the influence of ozonized ozone as a monotherapy together with MPVC. The third block included evaluating the influence of antioxidant therapy with toxidol as a monotherapy in combination with standard MPVS therapy by insulin. The clinical block of this examination had 104 patients with traumas. Most of the patients were young, between 18 to 35 years of age. The social layer of them, most of them were workers and athletes, most of the people traumatized. Depending on the time when they got this injury, mostly it was 1 to 12 days after they got the injury, they were admitted. Depending on the nature of the injury, it was a meniscus. Most of them were about meniscus, post-traumatic arterial, subchondral fractures of bones were also there. Depending on the methods of treatment that were used, so the patients were divided into 3 groups. So the first one received traditional treatment, so the second one had ozone therapies combined intravenously and intra-articularly with a preliminary lavage by ozonized solution, and we have a patent for this method. The third group included patients with antioxidant therapies by detoxidol. It was a systemic intravenous therapy. This is into articular therapy and the injection is shown in the slide. Research methods. Free radical oxidation were used Lipid products were evaluated, and antioxidant potential was also evaluated. For the immunity, they studied the activity of phagocytosis, humoral immunity, hemoglobulins, and circulating monocomplexes. Immune status. We used the cytokine profile against regulatory cytokines. The metabolism was evaluated by collagen. The cytological examination by cytogram was performed. Gives a morphometric examinations with staining the tribacillin with a morphologic evaluation of the cartilage, and the number of chondrocytes was evaluated. The result: when modeling the trauma, the balance of was developed. By the end of the experiment, there was a growth of tissue elements, macrophagocytes, in non-differentiated cells, part of free radical process. When we identified the growth, the max cumulescence, and there was. When determining the cytokine profile, there was an increase of pro-inflammatory cytokines, non-suppressed, reinforced by secretion, and anti-inflammatory inflammation markers. Free radical cytokine aggression aimed at the metabolism markers of collagen, leading to its destruction. We saw a growth of free fraction oxyporelin, which showed intense destruction of collagen. Also, there we saw at the end of the experiment a large growth of protein fractions, which evidenced intoxication of hyperglycogenesis with excessive accumulation of collagen, sclerosis of the cartilage, synovial and synovial membrane. It was morphologically confirmed. There was the length of the cartilage, because of the inflammation, became bigger. There were oozers that reached the subchondral bone. Destruction of chondrocytes was also there. Non-cellular zones appeared, which was accompanied by a decrease in the number of chondrocytes and their density. When staining it with chosen coloring agent, we saw sources of metachromacy, which showed the destruction of sulfatized glucose amino glycans. Evaluation of the synovial membrane showed an increase in the covering sclerosis of the vessels in the synovial layer, which showed irreversible degeneration processes in the synovial membrane. The results of the performance scan look like this. Traumatic injuries lead to activation of leukocytes and tissue cellular elements to the release of inflammation mediators that lead to the intensification of free radical processes, the development of cytokine imbalance, which have a direct action, and because of the activation leads to some ferments, it leads to the destruction of chondrocytes, novocytes, and the non-cellular extracellular matrix, which lead to the progression of posttraumatic osteoarthritis, which is irreversible because of the low reparative capabilities of the cartilage, and because of the activation of fibrinogenesis, which is incomplete. There is sclerosis of the synovial membrane also of the cartilage and subchondral bone. The next block of the research included an evaluation of the PVS therapy, including ozone and oxidol injection as a monotherapy and in combination. When evaluating the processes of oxidation, this therapy on the end of the experiment led to a decrease of processes of free radical oxidation. However, the values were above the norm. The influence of the ozone therapy proved to be more significant than in the NSAID therapy, and there was activation of antioxidant potential. Together with oxidol, the values were near the norm. In combination with NSAID, they were not any different. Evaluating the CHekmaeva profile together with side therapy, there was no balance of cytokines. When there was the ozone therapy involved and toxidol therapy as a monotherapy, the influence on the cytokines was comparable to the inside therapy. When there was a combined injection of ozone and inside, the ozone values went down, and xenol and inside they were no different from the norm. The evaluation of the pathogenetic method influence on the mechanism of the pathogen with Mr. Lid also used. There were no restoration of the metabolic turnover of which is seen here. The influence of the ozone therapy was more significant. With the toxidol therapy in combination with NSAID, the oxyproline fraction indicators were near the norm, which meant that the dissociation processes were limited, and the excessive proliferation of collagen structures were limited also. Synovial cytograms were examined, and the min-solid therapy improved the inflammation process. It was not so severe, and there was a decrease in the level of neutrophils, but the progression of dystocic processes remained there. According to tissue cell elements, macrophages, and cytotoxic therapy by ozone and toxidol had an anti-inflammatory effect compared to NSAID, but there was a considerable limitation of the tissue and cellular elements. Combined methods of treatment led to this indicator to the norm of synovial cytograms. Morphological changes in their evaluation. With NSAID, the destructive changes extended to the surface, superficial, and intermediate zone. When stained with tyrosine coloring agent, there was a demasking of the collagen fibers because of destruction of the sulfosylate aminoglycase. In the synovial membrane, there was an increase of the covering, diffuse cellular infiltration, thrombosis of vessels of the subsynovial layer. In the C, where the ozone was used, there was the histoarchitecture was remained. There were some oozers that extended to the surface of the cartilage. There were no destruction changes. The diffuse and cellular infiltration was low. In the vessels of the synovial layer, there were no thrombosis formation. When evaluating the morphology using toxidol, the cartilage had a characteristic structure. The significant change or effect of the antioxidant therapy was that in the intermediary area there was an increase of the quantitative density of chondrocytes, which pointed to a reinforcement of repair processes of the cartilage tissue, and it also has chondroprotective properties. This approach, when evaluating this stained with tyrosine coloring agents, the sources were found only in the surface. When using the combined combinol and penicillin, the cartilage and the synovial membrane were no different visually from the intact animal data. The block of clinical investigations. Here we, for the first time, use systemic ozone therapy together with local ozone therapy lavage or interoperational lavage by ozonized solutions with interarticular injections of ozone post-op, and for which we got a patent. Besides, for the first time on post-traumatic period patients, we use systemic antioxidant therapy with etoxidol. Pathogenetic methods of correction led to the inhibition of process of free radical oxidation, more so than to traditional therapies, and etoxidol had a better effect than ozone on the processes of free radical oxidation and the antioxidant potential. When studying the immunological disorders, the pathogenetic methods of correction had a good immune correcting effect. Etoxidol had a better impact on the oxygen-dependent process and interference that inhibited the level of immunoglobulin and circulating immunocomplexes. When looking at the cytokine profile, the pathogenic methods of correction inhibited pro-inflammatory cytokines, and the therapy was more significant.
Они шепчутся, я их слышу.
The changes in metabolism of collagen in patients in posttraumatic arthritis identified that metabolic turnover of collagen improved due to the toxidol therapy than in the ozone therapy, and the fraction was near a norm. With pathogenic methods of correction, the balance of synovial cytograms improved. There was a decrease in the number of leukocytes and non-differentiated elements, cellular elements, and surface synovial cells. The functional evaluation of the joints was done by us, which was confirmed by decrease in the pain feelings. There was a decrease in synovial and the amplitude of movement was improved. Toxidol therapies improved the functional state quicker, and it's not was not any different from the contralateral joints. Based on the results achieved, we can conclude the following. The problems of progression of post-traumatic arthritis should be seen on a wider scale than traditionally it is, when the basis was just problems with congruency. The material we got improves the post-traumatic automatic problems. Free radical cytokines predictors of alteration. The nimesulide therapy does not lead to the recovery of homeostasis in the joint in the synovial medium of the fluid, which improves the progression of osteoarthritis because nimesulide does not affect certain chains of pathogenesis. It doesn't inhibit the high activity of free radical processes. This pathogenetic justification of the ozone therapy in the post-traumatic period, as ozone has high anti-inflammatory effects, it corrects by radical potential, it improves the metabolic process of collagens, it improves the functional state of joints. The proof we got for the antioxidant therapy to keep the integrity of the joint. The counter-protecting the effects of netoxidol has been proven for the first time, which is proved by the improvement in the density of chondrocytes and no destructive changes in the extracellular matrix. The most significant correction here in the chains of pathogenesis is achieved through a combination of intra-articular therapy and ozone therapy. It should be combined with non-steroidal anti-inflammatory drugs. It defines the concept of early combined inhibition of alterations. Through this new area of intra-articular injection, together with oxide, which gives better clinical effects by drugs which affect different chains of pathogenesis, in posttraumatic arthritis. We got 3 patents for it, for different methods of diagnosis and for different methods of treatment of this pathology. Thank you very much for your attention.
Засунь свой язык себе в жопу.
Okay. Any questions to the speaker? Any questions? Alexei, what would be the concentration of ozone which you used in the inter-articular injections? In inter-articular injections, in animals we used 15 milligrams, because for rats the dosage was higher. For patients it was 5 milligrams. We didn't want to activate free radical processes, you know, because ozone is a strong oxidizer. You know, sometimes it's like 20 or 30 milligrams. I know. There are such methods, so we decided to go with this low dosage because we proved that in traumatic injuries we see the activation of processes of free radical oxidation. Any more questions to the speaker? No questions. Oh, there is a question coming up. Oh, no microphone. Well, there are such works. Autoplasma sometimes is administered. Zahvatov, for example. Maybe later we will work on it. Maybe autoplasma could be ozonized as well. Maybe autoplasma can be administered. Thank you very much for your report.